ADHD or attention deficit hyperactive disorder. The fact that you are hearing me talk about it is because you already know about this problem. Your child has been diagnosed with this problem. You've read this problem. Your doctor has told you what it is all about. So let me not waste my time talking about what it is, how it happens, and all that. Let me talk about what can be done about it. The first thing that I'd like to tell you is, as a parent, if your child has been diagnosed with ADHD, the most important thing for you to do is accept his problem. Most parents and grandparents don't accept the problem, particularly the older generation. The grandparents would say, you're not raising up your child well, punish him, do that, do this, he'll be alright. You've been also like that in your childhood, but you become alright. There are many kids like that, all they need is one slap. These are the things that you hear people talk about, but that's not true. There is a reason why they are ADHD. Well, in my practice, I can think of reasons why I've seen a lot of children get into ADHD. Number one is a traumatic birth where there is a cord around the neck or something happening during the delivery. Let's see how to deal with the situation. Well, once you're diagnosed, you go to the doctor. The doctor will tell you a lot of therapies that needs to be done. There are special educators who teach these ADHD kids and they do a wonderful job. Trust me, a lot of kids who have come to me have improved tremendously under these special educators. You must find these special educators wherever you are in this world. Don't expect your child to get better in the normal school. They cannot get better in the normal school. They need those special educators to give them that extra bit of information, that extra bit of coaching. There are different techniques with which they treat, and most kids, they catch up and they are back to normalcy. This is very, very important. Special educators who treat ADHD kids are very, very important in their treatment. There are a few diets that can be followed. GFCF diet is one of them. I have been recommending a particular diet in my website, Dr. Manoj's diet plan. I've seen this helps the child to calm down quite a lot. How does this help? These kids have a lot of energy. That's why you find them hyper. They're all the time on their feet, moving from here to there, doing something. They can't sit at one place. What gives them this energy? The food that they eat is what gives them energy. So I believe that if you're able to cut their food, cut their energy, by giving them little to eat at one time, but every 4 hourly, I've seen it do miracles for these kids. GFCF diet has also helped. It has proven to be useful, but then it is very difficult to put this child on GFCF diet. You cannot avoid the sweets, the bread. It makes it very difficult. It's not practically possible, particularly in an ADHD kid. They'll be behind you. I know it can be traumatic to raise an ADHD kid. The mother goes through hell. The father probably gets his break when he goes to the office, but the mother is something the parents have to join together and take the responsibility. It's impossible for the mother to take care of the child alone. She will go mad. It's not the child's fault. He is like that. He can't help being himself. He will grow out of it. He'll be absolutely normal. You need to see him through a particular stage, particular age. And this can happen better if both the husband, wife and the entire family is in it together. This is the most important thing. What can homeopathy do? Homeopathy works on the mind. Homeopathy calms the child. Homeopathy stops him from reacting the way he is reacting. Homeopathy helps him focus on a particular thing. So we've had parents coming back to us saying that once we started homeopathy, the child has calmed down, he's able to sit for longer, he's listening to us, he's able to emote himself, he's able to react, he's able to respond. There are a lot of positive things that happen once a child starts on homeopathy. I'm not saying that we are able to do some miracles. I'm not saying that you can see the child improve immensely the moment you start on homeopathy. No. Within a few months' time, you will be able to see a dramatic improvement in the child with medications. I'm not in favor of starting the child on allopathy because that medicines will subdue him. That will make him calmer, that will make his brain calmer, but that's not him. You're making him somebody else. You stop the medicines, he's back to square one. That's not the way to treat ADHD. We need to help the child go through these issues and overcome it in the most natural and efficient way. And I cannot think of anything but homeopathy to help him. Yes, yoga, breathing exercises, meditation can do a lot if you are able to put him on it. My recommendation, start him on homeopathic medication. Put him on physical therapies, whatever are available, occupational therapies available. The special educators are very, very important. A combination of these, you can sail through ADHD very, very easily. Take care of your child. He's precious. He's going to be fine in a few months' time, few years' time. You won't even know that he's had a problem. Till then, be patient, take care of him.